Hello, everyone, and welcome to Understanding How Cancer Impacts Sleep. I'm Kelly Kraft, Program Manager at Gilda's Club Quad Cities. I am lucky enough to be here with Morgan Myers, Gilda's Club Quad Cities intern and OT student at St. Ambrose University. And I'm just going to let her take it away.
All right. So like Kelly said, my name is Morgan. I am an OT student from St. Ambrose University, and today I will be presenting on sleep and cancer. So I'm going to go ahead and share my screen and pull up my PowerPoint. All right, can everybody see this? Perfect. Okay. So like Kelly said, today we're going to be discussing sleep and cancer. So an overview of today's topics include the importance of sleep, how cancer impacts sleep, optimizing your sleep practices, and talking with your healthcare team. So first, we're going to start with the importance of sleep. Sleep plays a vital role in good health and well-being. Getting enough quality sleep at the right times protects your mental health, physical health, quality of life, and safety. Sleep helps your brain work properly. While you sleep, you're preparing for the next day, and your brain is forming new pathways to help you understand and retain information. Sleep improves your overall mood and helps control emotions and behavior. Quality sleep also improves decision-making, problem-solving, and promotes new learning. Sleep also plays an important role in your physical health. While you're sleeping, your body is healing and repairing itself. Sleep helps boost your immune system, lowers your blood sugar, helps maintain a balance of healthy hormones, and supports a better appetite. However, sleep disturbances are very common in cancer patients. In fact, 30 to 75% of cancer patients have reported trouble sleeping, which is 2 times the rate of the general population. Individuals with a cancer diagnosis sleep about 4.5 to 7 hours per night, while the general population sleeps about 6.5 to 7 hours per night. The Cancer Support Community Registry report found that 46% of cancer patients reported they were moderately to severely concerned with sleep problems, and 18% of cancer patients reported a worse quality of life related to sleep disturbances than the national average for sleep disturbances or sleep problems. These are all signs that a person may be experiencing a sleep disturbance. Trouble falling asleep, waking up several times in the middle of the night, and remaining awake, frequent and long naps during the day, difficulty concentrating, waking up too early in the morning, loud snoring, breathing, or gasping noises while you sleep, and lack of sleep or too much sleep can all be signals to watch for depending on the person. And as always, look for changes compared to a person's normal patterns. So now that we've discussed the importance of sleep, we'll move on to how how cancer impacts sleep. Fatigue, insomnia, and experiencing an irregular sleep-wake cycle are the most common sleep disturbances found in cancer patients. Fatigue is feeling overly weak and more tired than usual, or feeling the need to rest or sleep more. A 2011 review published in the Annals of Oncology estimated that 50% to 90% of cancer patients reported feeling fatigue, while insomnia is having trouble getting to sleep or staying asleep, and 31% of cancer patients reported experiencing insomnia. So how can cancer impact your sleep? Well, cancer impacts your sleep through different treatment, medication, and side effects, hospital stays, pain, fatigue, and mental health. Your sleep can be impacted if you have cancer treatment or medication side effects, and these side effects include pain, nausea, trouble breathing, and needing to use the bathroom, just to name a few. Stress and thinking about your diagnosis may keep you awake at night. In order to combat your stress, try deep breathing exercises, journaling before bed to get any worry or thoughts out of your head, or make a list of things you can do to help with this worry, which can include making a list of different questions to ask your doctor or asking a friend for help. There are several cancer-related and physical symptoms that are unique to the individual and can have an impact on your sleep. Be sure to talk to your healthcare team about any sleep difficulties you may be experiencing. As discussed previously, your sleep can be impacted by treatment or medication side effects, such as pain, nausea, or trouble breathing. Ask your nurse or doctor for ways to combat these symptoms so you can get to sleep and stay asleep. You may be prescribed another medication to help with any of these side effects. Chemotherapy, radiation, surgery, bone marrow transplants, and biological therapy may all cause fatigue. You may experience fatigue when chemotherapy or radiation destroy healthy cells in addition to the targeted cancer cells. You might develop anemia if your treatment destroys too many healthy red blood cells, and you can also develop anemia if the cancer has spread to your bone marrow and interferes with blood cell production or causes you to lose blood. Lastly, certain medications, such as pain relievers, can also cause fatigue. Your sleep may also be impacted by hospital stays. The hospital environment and hospital routine can create sleep difficulties. If you have to stay in a hospital, your sleep may not be ideal. You may be disturbed by noise, medical equipment, hospital staff, and just a generally unfamiliar surrounding. Tips for a long hospital stay include bringing comforting items from home, keep the blinds open during the day to help maintain a regular sleep schedule, ask for any medication or treatments to be administered during the day, and follow good sleeping habits. Your sleep may also be impacted by pain. There are different reasons for pain that cancer patients experience. This may include pain from the cancer itself, such as where the tumor is located, for example, spinal cord compression or bone pain, as well as surgical pain, which can last a few days to a few weeks after surgery. Individuals may also experience phantom pain after the removal of a body part. You may feel an unpleasant sensation from that area, despite the fact that the body part is gone. You may experience pain from side effects of chemo and radiation, such as neuropathy, mouth sores, skin burns, and scarring. This pain may wake you up in the middle of the night or prevent you from falling asleep. Talking to your doctor is very important in determining how to effectively manage your pain. Your sleep may also be impacted by fatigue. With cancer-related fatigue is one of the most common side effects of cancer and its treatment. It usually comes on suddenly and is not the result of activity or exertion. Fatigue is a daily lack of energy and an unusual or excessive whole body tiredness that is not relieved by sleep. It can be acute, lasting a month or less, or it can be chronic, lasting 1 to 6 months or even longer. Fatigue can have a profound negative impact on a person's ability to function and their quality of life. Data from the Cancer Support Community's 2020 Cancer Experience Registry report indicated that 4 out of 10 patients experience fatigue symptoms worse than the national average, and 50% of patients reported they were moderately to severely concerned with sleep problems. Fatigue levels can be impacted by your cancer, cancer treatment, anemia, pain, emotions, lack of sleep, nutrition, medications, lack of exercise, and hormonal changes. Talking to your doctor is very important in determining how to effectively manage your fatigue levels. However, there are different things that you can do to help relieve your fatigue. This might be conserving your energy. Save your energy for the most important activities. Keep track of these times when you feel your best and plan to do those important activities during those times. And don't be afraid to ask anyone for help when you need it. Maintain your energy. This can be done by drinking lots of fluids and eating well in order to keep your energy levels up. However, limit or avoid caffeine and alcohol. And if nausea and vomiting make it difficult or hard to eat, talk to your doctor about these side effects. Get moving. When you feel up to it, light exercise throughout the week may help you preserve your energy levels. Exercise regularly as you start treatment. You'll get into a routine of exercising, and it may even help you to prevent fatigue during your treatment. Relaxation techniques. Breathing exercises, body scans, and meditation can all help relieve stress and boost your energy levels. Your sleep may also be impacted by mental health. Many people with cancer experience mental health changes, including distress, depression, and anxiety. It is estimated that up to 1/3 of people treated for cancer in hospitals have a common mental health condition. Insomnia and other problems also increase the risk of developing depression. Cancer, depression, and anxiety have shared symptoms like fatigue, lack of sleep, and a decreased appetite, which can make it difficult recognizing mental health conditions. Sleep disorders are frequently associated with the psychological impact of cancer, as well as with the physical illness itself, pain, hospitalizations, and specific medical treatments. Altered sleep adversely affects emotional well-being and daytime performance and may be an early sign of delirium in the oncology setting. Data from the Cancer Support Community's 2020 Cancer Experience Registry report found that 49% of respondents were at risk for clinically significant levels of anxiety, and 38% of respondents were at risk for clinically significant levels of depression. Addressing mental health changes and can improve sleep quality and vice versa. It's important to talk to your healthcare team about your symptoms. If you're experiencing mental health difficulties, Gilda's Club also offers support groups, one-on-one sessions, or can help you find a counselor to best meet your mental health needs. So next we're going to try a little writing exercise. So if you have paper next to you, great. If not, don't worry about it. You can just kind of think about these different things. So before we get into different ways to optimize your sleep practices, think about how has cancer impacted your sleep? What emotions or feelings does this workshop bring up? And lastly, what hopes do you have for improved sleep? Go ahead and write those down and take a couple minutes to think about it. And at the end of the presentation, when we get to the questions and we're off the Facebook Live, we can go ahead and discuss these different topics if you would like.
For anyone watching on Facebook Live, if you were interested in commenting in some of your things that you're writing about, we can share that with the people watching live on Zoom.
Yeah, definitely. All right. So next we'll go ahead. And now that we have talked about the importance of sleep, how cancer impacts sleep, next we will move on to how to optimize your sleep practices. Changing your health practices and changing environmental factors can all lead to improved sleep hygiene. The next slide will indicate ways in which you can change your health practices and environmental factors around you in order to improve your sleep hygiene. These are the general categories in which you can identify ways to improve your sleep. This includes setting up a sleep schedule, following a nightly routine, cultivating healthy habits, and improving your bedroom or sleeping environment. So first, we'll discuss setting up your sleep schedule. Having a set schedule normalizes sleep as an essential part of your day and gets your brain and body accustomed to getting the full amount of sleep that you need. Have a fixed wake-up time. Regardless of whether it's a weekday or a weekend, try to wake up at the same time every day. A fluctuating schedule keeps you from getting into a rhythm of consistent sleep. Be sure to prioritize your sleep. It might be tempting to skip sleep in order to work, study, socialize, or exercise, but it's vital to treat sleep as a priority. Cultivate a target bedtime based on your fixed wake-up time, and do your best to be ready for bed around that same time every night. Make gradual adjustments. If you want to shift your sleep times, don't try to do it all in one swoop, as that can throw your sleep schedule out of whack. Instead, make small step-by-step adjustments of up to 1 hour or 2 so that you can get adjusted and settle into your new schedule. Reduce napping during the day. Naps can be handy to regain energy during the day, but they can also throw off your sleep schedule at night. To avoid this, try to keep naps relatively short and limited to only in the early afternoon. Follow a nightly routine. How you prepare for bed can determine how easily you'll be able to fall asleep. To do this, keep your routine consistent. Following the same steps each night, including things like putting on your pajamas and brushing your teeth, can reinforce in your mind that it's bedtime. Budget time for winding down. Budget time about 30 minutes before your bedtime to take advantage of whatever puts you into a state of calm, such as soft music, light stretching, reading, or relaxation exercises. Dim your lights. Try to keep away from bright lights because they can hinder the production of melatonin, which is a hormone that the body uses to facilitate sleep. Unplug from electronics. Build in a 30 to 60 minute pre-bedtime buffer that is device-free. Cell phones, tablets, and laptops cause mental stimulation that is hard to shut off, and they also generate blue light that may decrease melatonin production. Get up and try again. It helps to have a healthy mental connection between being in bed and actually being asleep. For that reason, if you go to bed, and if after 20 minutes you haven't gotten to sleep, get up and stretch, read, or do something else trying to fall asleep again. If you're experiencing pain and are prescribed pain medication, take this medication 30 minutes or an hour before bed if possible in order to reduce pain while you're trying to sleep. Next, you can cultivate healthy habits. This includes going to bed when you're sleeping and staying active during the day. It's not just bedtime habits that play a part in getting good sleep. Incorporating positive routines during the day can support your circadian rhythm and limit sleep disturbances. Staying physically active or regular exercise can make it easier to sleep at night and also delivers other health benefits. One way to stay physically active is to participate in yoga. Yoga is a mind-body form of exercise that has been shown to improve sleep among cancer patients. Yoga for cancer includes breathing exercises, gentle restorative poses, and meditation. One study had participants participate in a Yoga for Cancer program while the other group did not. At the end of the study, researchers found that the participants in the yoga group actually decreased their sleep medications by 21%, while the participants in the control group who did not participate in the yoga program actually increased their sleep medications by 5%. Healthy habits also include reducing alcohol and caffeine before bed. Alcohol may make it easier to fall asleep, but the effect wears off, disrupting sleep later in the night. As a result, it's best to moderate alcohol consumption and avoid it later in the evening. And because it's a stimulant, coffee can keep you wired even when you want to rest. So try to avoid it later in the day. Also, be aware of this if you're consuming lots of caffeine during the day to try to make up for lack of sleep. Reduce eating and drinking before bed. Eating dinner late, especially if it's a big, heavy, or a spicy meal, can mean you're still digesting that meal when it's bedtime. In general, any food or snacks before bed should be on the lighter side. Reducing eating and drinking before bed can also help reduce the need to wake up during the night to use the bathroom. Reduce in-bed activity. In order to build a link in your mind between sleep and being in bed, it's best to only use your bed for sleep, with sex being the one exception. So try to avoid doing any work or eating in bed. Improve your bedroom or sleep environment. Make sure your space is comfortable and fit for sleep. This includes having a comfortable mattress and pillow, setting a cool yet comfortable temperature, block out any light and drown out any noise, make sure your bedclothes are comfortable, and make sure distractions are at a minimum. Another activity that can assist with sleep disturbances is mindfulness-based stress reduction. This is an activity that is the self-regulation of attention on immediate experience and the recognition of events in the present moment. This is an active method to turn off pervasive thoughts and replace it with a conscious response. Mindfulness has been shown to have a positive benefit for sleep, stress, mood disturbances, and fatigue levels. So next, we are going to do a little mindfulness exercise of our own. Okay, so I would like everybody to please find a position in which your body is comfortable. Please close your eyes or gently look down at the floor, doing whatever you feel you need to do to feel comfortable. Now, take a few easy, slow breaths, and with each trying to release any tension you notice in your body. Simply begin to notice your breath, feeling your stomach rise as you breathe in and lower as you breathe out. Notice the rhythm of your breath. It is only natural that your mind may begin to wander. As it does, gently remind yourself to return your focus on your breath. Stay in this moment, gently breathing, connecting with your breath. Allow yourself to feel whatever you are feeling, and to be present with your current experience. Now gently open your eyes. So something simple like that is something that you can incorporate into your own daily routine, something that you can do 30 to 15 minutes before you go to bed at night, just to kind of clear your head of any negative thoughts you may be having and just to bring you back into that present moment. So now that we've discussed the importance of sleep, how cancer impacts sleep, and different ways to optimize your sleep practices, next we will discuss how to talk to your healthcare team. A study about sleep dysfunction in patients with cancer found that 44% of cancer patients reported a sleep problem in the previous month, but only approximately about 17% communicated that problem to their doctors. So how can you discuss sleep with your doctor? The first step is to tell someone that you're having problems sleeping so that you can learn about potential ways to fix it. These are questions you can ask your doctor or nurse if you're having sleep problems. These include, why am I having trouble sleeping? What steps can I take to sleep better? Would you recommend a sleep therapist who could help me with the problems I am having? And would you recommend would sleep medicine be advised for me? These are other ways that you can help with sleep issues. Relaxation therapy can be learned with a professional and then incorporated into your own routine, such as the breathing techniques that we just did previously. Sleep aids are very common for cancer patients and may also help with other issues, such as pain. Treating insomnia in cancer patients with a combination of pharmacological and non-pharmacological therapy may have a positive impact not only on the insomnia itself, but also on related symptoms, including pain, fatigue, and psychological distress. It is important to address other issues that are all causing poor sleep, like physical discomfort, in order to tackle the problem at the root cause. So next, Kelly is actually going to discuss some resources that are available to you through Gilda's Club.
Thanks, Morgan. Let me make myself a spotlight here. All right. And I'll remove yours. Perfect. All right. So I have a few things that I want to go over, just some resources for you through Gilda's Club Quad Cities and Cancer Support Community. So this is our cancer support helpline. They're open Monday through Friday and also have, it's just a great resource for when you need some assistance and maybe Gilda's Club Quad Cities isn't available right that moment. They have counselors and also resource specialists at that line that can help you kind of find resources and just get you to the right place if you're having any issues with anything. Morgan, can you go to the next slide, please? And so a few other things, Cancer Experience Registry is a really great resource. It's kind of like a big survey, kind of research survey to get patients and caregivers experience. When Morgan earlier was talking about how there was this data that they were pulling from to be able to get all these statistics, that's where that data is coming from. So if you're wanting to help with putting together things like this, they're also used to, like the data is used to help doctors know what people are going through and also even policy. And then we've got a great program that I always love to talk about called Open to Options. So that's one of our only one-on-one programs. And it's a really great thing to use whenever you're at a fork in the road in your cancer treatment. So whenever you're making maybe a cancer treatment decision, maybe you're starting treatment, maybe you're thinking of changing treatments or stopping treatment, anything in there, it's a really great way to get all of your thoughts onto one page and get yourself a list of questions to bring to your doctor. And frankly, speaking about cancer is our educational workshop. So like this one, and we bring in nurses, doctors, all sorts of different professionals and experts in their field to talk about different cancer topics. So that may be talking about a specific type of cancer or talking about sleep and cancer or talking about a new treatment, whatever it may be. But those change every month, so keep an eye on our calendar for those. Next slide, please. And just a little bit about Gilda's Club Quad Cities for anyone who's watching on Facebook Live right now. We are a cancer support community that provides 100% free programming for anyone impacted by cancer. So that's a person with a current diagnosis, that's survivors, friends and family, kids, anyone who's impacted by a diagnosis. And we have all kinds of wonderful things like our support groups. So we have support groups for all those different categories of people. We have educational workshops like this that change month to month. We have healthy lifestyle activities. A lot of those can really help with sleep. Like we have our Yoga for Cancer, which is a mat yoga program. We have weekly meditation, and we even have a bunch of those recorded on our Facebook and on our website to go back and watch if ever you're having trouble sleeping. We have chair yoga, which is yoga sitting in a chair, all kinds of things like that that can really be helpful for sleep. And we also have social programs and kids programs. So if ever you're feeling stressed out and you can't sleep or need any support, give us a call, because sometimes, as Morgan was saying, there are so many different things that can mess with our sleep, even stress and that feeling of isolation. If you're feeling any of those things, give us a call. We can get you into support groups or something that can help you get some of those things off your mind. Next slide, please.
So that just leads us to the questions.
All right, well, I am going to check our Facebook, make sure we don't have any questions really quick here. It doesn't look like we've got any other questions new here. So I am going to end our Facebook Live. Thank you for everyone on Facebook for tuning in today. If you have any questions, give us a call or email us, or go on our website. All of our contact information is there. Thanks so much.